Hello again, dental assisting students. We will now be going off to chapter 39 in your textbooks. So we'll be talking about lab materials and techniques. These are very, very important, ladies and gentlemen. This is a very important chapter. NB, NB, NB. I cannot emphasize this enough. We're talking about materials. You will be exposed to a lot of different kinds of materials in a lot of the practices. Everyone is going to have exposure to them, or a huge chunk that we'll be covering today. So it's very, very, very important that you guys know them, know their properties, know the different types of materials, between your hydrocolloids, your elastonomers, your elastic materials, even the subdivisions of each, their properties, their advantages, their disadvantages, and your role, like your function in terms of these dental materials. Okay, so let's go back to the presentations that we have uploaded on eTudo. So we'll be checking out the one on chapter 39. So firstly, we'll be covering hydrocolloid impression materials. So the first one being alginate. Alginate is your bread and butter. So alginate is an irreversible hydrocolloid. That is very important. Alginate, irreversible hydrocolloid. It is very, very common. We basically use it in like diagnostic casts, in study models, and especially with like primary and secondary impressions when we're making dentures or other prosthesis, but mainly dentures. We use them basically when there's less accuracy required, but they are still able to, how can I say, bring out an accurate three-dimensional shape of someone or a patient's teeth, as well as its surrounding structures. So in that aspect, yes, it's doing its job. So the primary agent in alginate is potassium alginate. So potassium alginate, the main ingredients are seaweed and kelp, which are normally found around the coast of Japan, overseas. But yes, and then from there, so that's the primary agent that brings about this 3D structure, and then from there a retardant is needed. So from this powder that you see as alginate, a retardant is needed, because without the retardant, if you just use potassium alginate as it is, it'll basically set before you actually even put it inside the patient's mouth. So basically, here's the patient. So the patient is, think of it as positive production, and then you're gonna take a tray. Let's say this is your a mandibular tray, it's a plastic perforated mandibular tray. Then you take an impression, so the impression that this produces is then known as a negative model. So this is a negative, or an impression, a 3D impression of the patient's mouth. And then obviously you're going to put some plaster inside it, or let's say we're making a model, and then the final product being the model is then the positive production or positive model of the patient's mouth. Does that make sense? So we went from negative, positive to negative, and then the final product being positive. Okay, no, that's just nice to know. It's not a, yeah, I just wanted to explain that. Yes. So the advantages of alginate, it's ease of manipulation. So basically we have powder, which is the powder substance being alginate, and there's water. So we can manipulate either the powder or the water, especially the water, to get the consistency that we are looking for. And then from there, minimal equipment is required. So basically, when we're taking an alginate impression, you just need the alginate powder, water, a mixing bowl, a flexible mixing bowl, your mixing spatula, and as well as, and your trays, obviously, to actually take an impression. It's economical. you don't really require a lot of things, like I'm saying your water, your measuring cup, your spatulas, and the powder itself. And then it meets requirements for accuracy. It won't give you a lot of detail, but it will at least be able to produce whatever you and your dentist are looking for at the practice. It's rapid setting. Rapid setting is an advantage and a disadvantage, if you can think of it that way. It just depends on the context of how it's being used. But yes, it does set quite rapidly, which is an advantage, because then the patient is not uncomfortable for an extended period of time. And then obviously, like I mentioned before, patient comfort, and then it can be used for both tissue and tooth impressions, and it's quite elastic, so it just gives us room to play around with the material itself. And then the disadvantages of alginate: loss of accuracy. Alginate is a very finicky material. In one, mixing it as a dental assistant and actually storing it properly so that it gives a good product by the time it gets to the lab. Ne? So in terms of loss of accuracy, there are two terms that you guys need to know about. Ne? That is imbibition and that is syneresis. So with imbibition, we're basically talking about an enlargement of the impression. So let's say now we took an impression, ne? And then for some reason, let's say it gets so we took an impression of the patient's mouth, and then let's say our impression was exposed to water. Let's say you poured too much water when you were disinfecting or whatever. That can actually affect and cause change to the impression, meaning when it gets to the lab, it's no longer an accurate depiction of the patient's mouth. So that swelling is known as imbibition. That is mainly caused by water. So you have to be very careful with how you use water when you are storing, as well as when you are packaging your alginate impression to go to the lab. And then the other one is syneresis. So syneresis basically is a shrinkage of our alginate impression. So normally both of them can be caused by atmospheric conditions. Ne? So let's say if now we took an impression and then it was exposed to either heat or dryness, or it wasn't stored properly, so it actually loses water. This causes the material to shrink. Ne? So then it won't give you an accurate depiction of the patient's mouth. So basically, I'm saying to say, alginate, one, you need to take proper impressions, you need to store it properly, and you need to send it or get it cast as quickly as possible, because it may affect the final product that you guys are looking for, because now it has affected the 3D structure of the patient's mouth. It doesn't look as the patient's mouth looks. Does that make sense? I hope so. Yes. So imbibition and syneresis are very, very, very important. So I hope you understood what I was talking about. And then from there, alginate has setting time. Okay, your slide, as I see it, talks about setting time. So I'm just gonna break it down in terms of setting time as well as working time. So you need to be able to distinguish between the two, setting time as well as working time. So your slide talks about setting time. So setting time basically is the time it takes from the time you as the dental assistant mix both the alginate powder and the water. A chemical reaction occurs. So from that time of the mixing up until the impression sets, that is the setting time. And then there's the working time. So the working time is the time from when you mixed the water and the powder, you mix them together, you loaded them onto your tray, and you gave them to your dentist to actually put in the patient's mouth. So that time for you to actually mix and load and give off is your working time. So now the setting time, there's two types of alginates, now, ladies and gentlemen. There's type 1, which is a fast set. So a fast set is normally advisable in patients who have like a gag reflex. So now let's say you put in, every time you put like a tray in, they start getting like, ne? Or with kids, because like they can't sit still. Okay, let's say if you're trying to make like an orthodontic appliance, so with a setting time of 1 to 2 minutes, that alginate, the type 1 alginate, is very ideal in those type of circumstances. And then the type 2 is a regular set. So with the regular set, this takes about 2 to 4 minutes. So that's like a normal patient, no gag reflex, no problems, just yeah. But both of them, 1 to 2 minutes and 2 to 4 minutes, is actually quite decent, né? So please just make sure you know between type 1 and type 2 the amount of time it takes for them to set, and then please also be aware and know of your setting time as well as your working time that I've already explained before. Okay, and then your slide then talks about packaging, storage, and shelf life. This I don't want to really go into detail because it depends from one practice to another in terms of which alginate they are using or they chose to use. Ne? So I think the one thing I'd like to emphasize is, ladies and gentlemen, please read the manufacturer's instruction. Follow whatever the manufacturer told you to do with their product so that it works correctly, okay? Because one type of one brand of alginate will not have the same instructions as another brand of alginate. You might be working at a practice that predominantly or only uses type 1 alginate, whereas someone else might be exposed to a type 2 alginate type of practice. So just follow, just read whatever the manufacturer instructed you to do, and just follow it so that you can get the best results. Like others tell you to like fluff or shake the powder before you actually start using it. And then, but more than anything, I think what is general to all alginates is store it at room temperature and store it away from water. The water situation is to avoid contamination. It is to avoid imbibition and syneresis, as we had discussed before, because it can actually cause your alginate to be useless if exposed to water, because a chemical reaction will occur. Okay. So I think that's what I have to say about packaging, storage, and shelf life. Okay, and then with the shelf life, then obviously you'll always take care or be cognizant of the expiry dates on your product, so that then you can alert your dentist whether, hey, we need new material and so on and so forth, so that your dentist can buy them accordingly. Okay, but main thing, store it at room temperature and store it away from water, then you should be fine. Normally in a plastic container or in the container that it comes in. Others come in like a foil type of container, but normally it tends to be in plastic. Okay, so you can do that as well. Then from there, the next slide talks about ratios. So there are specific measuring devices for alginate. So normally in alginate, ladies and gentlemen, we use perforated trays in dentistry. I bought 3 examples today. Ne? So this would be an example of a maxillary tray. Ne? And then this would be a mandibular tray, and then this is also, ladies and gentlemen, a mandibular tray, ne? But this is normally a tray that we use on edentulous patients. So literally there's just a ridge left, like the patient has no mandibular teeth. So the ratios, the alginate ratios, also very, very important. You will be asked and examined on them, ne? So with your mandibular trace or mandibular impression, ne? You're going to use 2 scoops of alginate powder with 2 scoops of your measuring cylinder, ne? And then with the maxillary tray, you're going to use 3 scoops of alginate powder with 3 scoops of your water measuring cylinder. Okay, so yeah, those are very important. Those are some of the ratios, ne? But I also need to be to make you guys have this at the back of your mind.